Good morning. My name is Olivia Casey, Senior Director of Programming for the Autoimmune Association. Welcome to Autoimmune Voices, Threads of Hope, a podcast from the Autoimmune Association. Today, we have the pleasure of speaking with Dr. Vicky Shanmugam, who is the Director of the Office of Autoimmune Disease Research within the Office of Research on Women's Health at the National Institutes of Health, or NIH. For anyone listening, autoimmune diseases are personal. Whether you're living with one, are a caregiver, or a friend of someone, or are working to unlock the science behind them, you know these conditions can be life-altering, and far too long they've existed in the shadows of our healthcare system. But that's starting to change. And today, we're shining a light on what could be one of the most important developments in autoimmune disease research to date. In 2023, the NIH established the Office of Autoimmune Disease Research, known as the OADR, in the Office of Research on Women's Health. It was born from years of patient advocacy, a powerful directive from Congress, and the findings of the National Academies of Sciences, Engineering, and Medicine report that made one thing clear: the time for coordinated strategic autoimmune disease research is now. At the helm of this effort is Vicky, who was appointed in late 2023 as the OADR's inaugural director. Vicky earned her undergraduate degree from Oxford University and her medical degree from the Imperial College of Medicine at the University of London. She completed her internal medicine residency and rheumatology fellowship at Georgetown University and later served as a professor of medicine and chief of the Division of Rheumatology at George Washington University, where she led NIH and other federally funded studies on inflammatory disease, wound healing, and immune-driven tissue injury. A fellow of the American College of Physicians, the American College of Rheumatology, and the Royal College of Physicians in London. She's widely respected for her work integrating science, clinical care, and health systems leadership. She's also a prominent speaker and is a host of ACR Journals on Air, the American College of Rheumatology's podcast. Today, she joins us to talk about why this moment matters, how the landscape is shifting across the NIH, and how this new office is helping chart a more hopeful, forward-into path forward for autoimmune research and for patients it serves. Welcome to Autoimmune Voices, Dr. Shanmugam.
Oh, Olivia, thank you so much for having me. It's really a pleasure to be here.
Thank you for joining us. Before we dive into the work of the OADR, I want to start by getting your view on where things stand. Autoimmune diseases are clearly on the rise. From where you sit, what does the landscape look like right now? What's changing, and why does this moment feel so important?
Well, as you know, autoimmune diseases are collectively one of the most common groups of chronic diseases in the United States. It's estimated that across the 140 different autoimmune diseases, they impact about 50 million Americans, which is a huge number of people living with autoimmune diseases in the United States. Just to place it in context, there are about 6.5 million Americans living with Alzheimer's disease and about 16.7 million Americans living with coronary artery disease. So 50 million Americans is a huge portion of our population. And what we've seen in recent years across several different studies is that the prevalence of autoimmune diseases is increasing, and that there is a sort of growing recognition of the profound impact that these conditions have over the lifespan. In the last few years, we've also had a number of pivotal discoveries that have kind of shifted how we've approached autoimmunity. So new treatments have been identified for both common and rare autoimmune diseases, but also in some autoimmune diseases, we're starting to see a shift from treating the disease once it's established to trying to understand the period before the disease completely manifests itself. And treating in that pre-disease phase to try and prevent progression of autoimmune disease. So there's a lot going on, and it's a really exciting time.
Well, I'm just curious, can you share any recent data or studies that really underscore this shift, or even a moment in your own personal work that made you realize we were entering this turning point?
Yeah, I mean, I think there have been a number of studies, both in the US and in Europe, that have shown rates of autoimmunity are rising. And what they've shown is that this is not just that we're increasingly recognizing autoimmune diseases, although that is true, and we are. They're rising at a rate that can't be explained just by increased recognition, can't be explained by genetics alone. And what that tells us is that there must be some other trigger, an exposure perhaps that people are experiencing that plays a role in the development of autoimmunity. I would say one of the most important turning points, and I think you mentioned it in your introduction, was the 2022 National Academies of Sciences, Engineering and Medicine report, also known as the NASEM report. I actually, carry it to and forth from work with me. I go to bed with it at night. This really helped us think differently about autoimmune disease. It was commissioned by the NIH in response to a request from Congress. And it really identified some gaps and promising areas where future NIH-sponsored research really could make a difference to this field.
Well, in full disclosure, the week that it came out and I got a copy of it, I read it 3 times. Back to back, because it was so compelling. I strongly encourage everybody to log in and download it. It's wonderful. But I'm curious, though, after having read that, I thought, why has autoimmune disease research historically lagged behind things like cancer or heart disease?
Well, I think the immune system is complicated, but what we know is the immune system goes everywhere. So, some years ago, people had the great foresight to recognize that studying all different types of cancer under a single umbrella of the National Cancer Institute galvanized the science. It allowed the science to move forward more rapidly. And I think when the National Academies put together this report, that was one of the things that they were really articulating, is that coordination is crucial. And having a coordinated research strategy will enhance collaboration and accelerate discoveries.
Yeah, and I think that, the report really highlighted some misconceptions that I had, and I'm sure that others did, but I'm curious, do you think that there are misperceptions that still hold autoimmune research back?
So one of the most important paradigm shifts that's really been identified just in the last few years is this understanding that we need to spend time better studying the prodrome of autoimmunity. And by that, I mean the early phase of disease when the body is sending out warning signals, but before full-blown autoimmune disease has manifested itself. Any of your listeners who's living with autoimmune disease has probably experienced this. There's a period of time where you're sick, and oftentimes the doctors can't yet make a formal diagnosis. Well, science has told us that prodromal period is crucial. So we know from an autoimmune disease in children, or most commonly affects children, called type 1 diabetes, that if we intervene in that prodromal period, we can actually delay progression to full-blown autoimmunity. So just by way of background, type 1 diabetes is most commonly presents in childhood, although it can present in adults. And kids who have type 1 diabetes, their siblings are at increased risk. So typically, if you have one child who has type 1 diabetes, the siblings will be screened, and they get screened by testing autoantibodies. And what we know is there's a period between when the autoantibodies develop and the disease becomes clearly manifest. In just a few years ago, in a study that was a direct result of NIH-funded research, we learned that using an immune modulating medication, a monoclonal antibody against a molecule in the immune system, in that early prodromal phase in kids at risk for type 1 diabetes who'd not yet fully developed the disease, we could delay progression to type 1 diabetes, which for those kids is enormous, because otherwise they're on lifelong insulin, and being able to delay progression to full-blown diabetes tells us that prevention is possible. And if it's possible in one autoimmune disease, it's probably possible in others. That prodromal period, we know, exists in all of the autoimmune diseases. In some diseases, it's relatively short. So type 1 diabetes, it's usually months to a couple of years. In diseases like lupus, it can be longer. In multiple sclerosis, it can be as long as 10 to 15 years. So it's a very variable period. But what this research tells us is that prevention of progression is tantalizingly possible. And it makes me think that this is really where we need to focus some energy and research.
That's so exciting. This is just, groundbreaking stuff. It's just tantalizing. Absolutely. And, knowing how complex autoimmune research can be, and I know, I've done any number of diagrams about how research occurs across the campuses, across the NIH. Can you help us understand what the research environment was like before you came with the OADR, and why creating this new office was such a needed step forward as it was requested in the NACIP report?
Yeah, so NIH has for years supported a broad range of basic and clinical research on autoimmunity and autoimmune diseases. When the Office of Autoimmune Disease Research was formed, Congress specifically requested that we analyze the autoimmune disease research portfolio. And what the office has learned from this deep dive into the portfolio, as I said, of more than 140 different diseases, is that autoimmune diseases are one of the few research areas that is really touched by every single research institute and center at the NIH. The kind of flip side of that is that the diseases are not funded by any single institute or center. And so because of this, what we know is that the research happens broadly across different institutes and centers, and is really kind of according to each of those institute and centers' individual mission as to what area of the autoimmune disease research portfolio they take on.
So you mentioned, I know that one of the challenges is because of the nature of the vertical integration. So what do you see as the greatest challenge or silo that would be particularly difficult to overcome as you look to kind of strategize and coordinate this effort?
So what we've learned is obviously autoimmune disease affects millions of Americans, but one of the biggest silos is the lack of integration of data. This limits the ability of researchers to be able to perform comprehensive analysis across distributed data sets. So you may know there's many different studies of different specific autoimmune diseases happening both across the NIH and within various other research organizations. But it's very hard as a researcher to analyze across those distributed biorepositories of data. One of the most important initiatives that the Office of Autoimmune Disease Research has been working on is the development of a federated data platform specific for autoimmune disease research. And this type of platform allows researchers to really take a data-driven approach to uncover mechanisms of autoimmunity and to accelerate new discoveries and potential therapeutic advances.
Well, what I see, this is just fascinating. So what would you say is the defining role that the OADR can play in response to the NACIP report's call for this coordinated effort that you're doing? How do you balance that coordinating role with all the independent priorities that each of the institutes has?
Well, the mission of the Office of Autoimmune Disease Research is to support high-priority autoimmune disease research, to identify emerging areas of innovation, and to foster collaboration across the NIH institutes, centers, and offices. And we've done a number of things to help that coordination. If you'd like to kind of get a deep dive into the work that we're doing, we do have a report that covers the first 2 years of the office since its inception, that's available on our website, and you can download it and take a read. It goes through each of the 6 congressional objectives that we were tasked with and the progress that we've made towards each. The other thing I would mention is that we've done a number of things to try and coordinate across the different institutes and centers, including establishing a coordinating committee for autoimmune disease research. And we have representation on that committee from every single institute and center. And that's really helped us kind of galvanize some of the energy around this field.
Well, I'm thinking about our listeners who may not fully understand how federal research funding works. Can you explain a little bit about that process, and then why is this central to the coordination, the NIH coordination? Why is it so critical?
So as I'd mentioned, each institute and center at the NIH supports autoimmune disease research in alignment with their individual mission areas. So establishing a centralized Office of Autoimmune Disease Research has enabled coordination across the NIH focused on accelerating autoimmune disease research. And to kind of initiate that process, one of the things that Congress asked the office to do was to develop a comprehensive NIH-wide strategic research plan for autoimmune disease. So as we started that process now, 18 months, almost 2 years ago, we formed this coordinating committee, had representation from every single institute and center, and then from that coordinating committee pulled out a strategic plan working group that has ensured that all of the institutes and centers gave input into the development of this strategic plan, and that the strategic plan really dovetails with the missions of all of those individual components to focus on what's needed for the field and how we can move this forward.
And I know from that strategic plan that you opened that up to advocacy groups and patients as well. I know that we all were able to make commentary, which was a wonderful opportunity. And I'd really love to hear more about what the OADR is doing to directly address what patients expressed as their greatest concerns, like faster diagnosis or better treatment options, and a real understanding of things that trigger or worsen disease. I'm curious, what are some of the promising developments you're seeing now that give you hope?
I'm glad you raised that point, because as someone who has spent decades sitting at the bedside with my patients, hearing their stories, what I've learned is that if you start with what matters to people who are living with these diseases, you will focus on what's important. And so it was really top of mind for us as we started to develop this planning process, that we hear from the people living with these diseases where the gaps were, what was needed. We did a number of things which you will recall. We opened a request for information, which is a way that the NIH receives input from the community. That was back in the very early part of 2024. And we also hosted a number of community roundtables where we heard personally from people who are living with these diseases. Those two inputs were incredibly valuable. We also took information from the various institute and center directors, the people who are coordinating research in each of the disease areas, and the feedback from all of these sources has really gone into the strategic planning process. And the priorities and objectives that have been developed for the strategic plan are really built around the core of what is needed, what we can do to better coordinate, and how we can advance and translate scientific discoveries into practical applications.
And it's offering such incredible promise based on what you're telling us, and certainly what I'm reading. And I'm curious though about the promise. Are there specific studies or partnerships that you're particularly enthusiastic about that patients might want to follow? Is there something that we should all be tuned into that you think might be something of specific interest?
Oh, absolutely. So a program that I'm incredibly excited about, and was the inaugural funding opportunity from the Office of Autoimmune Disease in conjunction with a number of different institutes and centers, including NIAMS and the Institute of Environmental Health Sciences, is the Exact Plan initiative. So this is It stands for the Exposome in Autoimmune Disease Collaborating Teams Planning Awards. We issued 6 of them, and they have been really focused on supporting design and development and implementation of an interdisciplinary collaborative team that can focus on advancing the study of various exposures that happen across the lifespan in autoimmune diseases, both in established disease and in that prodrome of autoimmunity. And this team has been very energized. They've been extremely productive. They host each year a summit, which I've had the good fortune to attend, that is incredibly exciting to watch them work, to be honest, and to hear kind of how they're moving the field forward. You can read a little bit about the recipients of those awards and the diseases that they're studying on our website, and I think I gave your team the link, so that should be in the notes from today's episode. But keep watch on that, because it's something that we are very excited about, and I think will help the field move forward.
That's very exciting, truly. So something that comes up though in our discussions is, because autoimmune diseases intersect with so many other conditions like cancer and cardiovascular disease and mental health and even COVID, long COVID. How will the OADR work to leverage research in these overlapping areas? And how do you see that kind of cross-cutting collaboration shaping the future of the research?
And I'm glad you brought that up, because that's something that really came out as one of the themes from the National Academy's report, and historically has been a bit of a challenge in this field. So it is extremely common for an individual with one autoimmune disease to develop a subsequent autoimmune disease. And yet it's very tricky for a researcher who wants to study that combination of autoimmune diseases to find a home for their research, and particularly a funding home for their research, because each institute and center currently funds according to their own mission areas. And so this was something that the National Academy has identified as a gap that they would like to see the NIH coordinate better on. And anyone who has an autoimmune disease has probably experienced this. It's incredibly common for example, someone with rheumatoid arthritis to also have another autoimmune disease like autoimmune thyroid disease. But those two diseases would have a different research home as the current structure stands. So one of the things that we've spent a bit of time thinking about is how to really enhance that research that would otherwise fall through the cracks. A huge success that we had last year was that we were able to bring in a new center into the Autoimmune Centers of Excellence program, which is a long-standing, established program led by the National Institute of Allergy and Infectious Diseases, NIAID. And we, as a result of Office of Autoimmune Disease co-funding, we're able to bring in an additional center studying autoimmune endocrinopathies. They'd not had a group in that area of expertise before, and it has been an incredibly galvanizing process. They, again, as a result of that co-funding, we get to sit on the steering committee and watch the researchers do their work. And it's been really exciting for me to see what bringing in a group of scientists who had been long-standing studying autoimmune endocrinopathies in their own field, now collaborating across disease areas that they wouldn't have previously come into contact with. So, those things do make a huge difference. If you'd like to read a bit more about the Autoimmunity Centers of Excellence, I think there's a link for that also in your notes from today. I'm really excited to see how that science evolves.
Okay, then you're going to have to give us a preview here. So what do you see as the most promising research happening right now in autoimmune disease? And do you think, and this is just one of those rando questions, do you think that one day we might be able to see cures?
So I'll say two things. I think there's lots of promising areas. There's lots of new scientific discoveries in the realm of targeted therapies, and a number of different research areas in that field. And then there is this kind of large and ever-growing body of science in the prodromal field, which I think will be where you're most likely to see interventions that lead to prevention or cure. I certainly hope that we will eventually get to that place. We're not there quite yet. But if we look at even just the last 50 to 70 years, autoimmune disease research is a really young field. The concept of autoimmunity wasn't even accepted as a field until 1956, which is when there was a first description of the autoantibodies associated with autoimmune thyroid disease. And that has, if we look at what's happened since that time to now, we've developed biomarkers and autoantibodies for lots of different autoimmune diseases. We've identified treatments that use antibodies to target the immune system, which is, a completely pivotal turning point in the field. And now we're getting to the place where there's precision immunotherapies and new ways of targeting the immune system, even using your own immune system to target the cells and molecules that are causing damage. So really exciting time, and thrilled to be part of this field.
There just seems like there's just so much excitement going on. And I'm curious, as part of the advocacy community and for patients, how can we participate in the next stage of development to help secure and support these successful engagement? What can patients do at home to help?
I think that's also a really important point. As you know, and as you've said, the Office of Autoimmune Disease Research was really born from the power of the autoimmune disease community, and certainly amplifying the importance of this work is incredibly helpful to the future. Every citizen has a right to talk about the things that matter to them, and I think finding your voice and using it to tell people about something you care about and something you have lived experience about is not only empowering, it gives you some autonomy back, but it makes a difference to the whole community. The other thing I would note is that joining research registries and research studies for autoimmune disease is also a great way to pay it forward, because the gift that you give helps the people who come after you, and I think is another really important thing that people can, on an individual level, participate in the research.
Well, before we wrap up, I want to take a step back and look at the bigger picture. You've described a vision for the OADR that has the potential to shift how we approach autoimmune disease research. When you look ahead, what are you most excited about, and what keeps you motivated in this work? For us, what do you hope patients will be able to take away from this moment in time?
No, I'm motivated by the 50 million listeners to your podcast who live with and are at risk for autoimmune diseases in the United States. I'm really excited about our upcoming release of the 2026 to 2030 inaugural NIH-wide strategic plan for autoimmune disease research. It will be launched on July 21st, 1 p.m. Join us. And I think that kind of will set a groundwork and a bit of a roadmap as to how we can work together to advance this field. I think it's also important to remember we can do more together than we can ever do alone. And so by advancing autoimmune disease research, we're really going to advance the health for all Americans. And that's a really exciting thing.
And just one more thing. If we were going to have this conversation in 5 years, what do you hope we'd be able to say has changed?
Oh, well, so to start, I hope that you invite me back more than 5 years, sooner than 5 years from now. But when I look ahead, I really hope we make progress on the strategic priorities and objectives in the upcoming strategic plan. And I hope we make a difference for the people living with autoimmune disease here in the US.
Thank you so much for your incredible insights today, Dr. Shanmugam. This was really fantastic. And we've learned not just where the science is going, but how far we've come at this stage in exponential change and new pathways for research. For those of us who live with these conditions or care deeply about someone who does, this conversation really does offer hope and a clearer sense of what's possible when research is better connected. And that makes me genuinely excited for what's ahead, and we'll continue to learn. And thank you so much. And we will absolutely have you back before 5 years.
Thank you so much, Olivia. It's really been a pleasure chatting to you today.
Thank you so much.